Hello everyone, my name is Manoj. I am a postgraduate in pharmacology and currently working as a pharmacist. Today I would like to talk about the importance of glycine in our body and also in COVID-19 patients. So what is glycine? Glycine is a colorless, sweet tasting and crystalline amino acid. It is one of the amino acids that our body uses to create proteins. The proteins are needed for the growth and maintenance of our tissues and also for making important substances like enzymes, hormones and neurotransmitters, etc. On the other hand, glycine is the major inhibitory neurotransmitter in the brainstem and spinal cord. By the way, our body naturally produces glycine from other amino acids and it's also found in protein-rich foods and available as a dietary supplement. What's the role of glycine in our body? Around 20% of body's amino acids are glycines. Glycine is one of the important amino acids that our body uses to make glutathione, which is a powerful antioxidant. Glutathione helps to protect our cells against oxidative stress, which is caused by free radicals and are thought to underlie many diseases. Glycine is also an important amino acid that our body uses to make a compound called creatine. Creatine is something which provides quick energy for gym activities like weightlifting, strengthening, gaining the muscle size and power. Similarly, collagen is a kind of protein which is very rich in glycine. Collagen provides strength to our muscles, skin, cartilage, bones and ligaments. Research suggests that glycine may reduce the harmful effects of alcohol by preventing fatty liver, alcoholic hepatitis and alcoholic cirrhosis. And higher levels of glycine in our body reduces the risk of diabetes mellitus. And increasing evidence also suggests that glycine can improve our body's ability to use natural vasodilator called nitric oxide, which will lower the blood pressure, thereby reducing the risk of cardiovascular diseases. What's more, glycine plays a biggest role in hemoglobin synthesis, improving the cognition power and reducing the chances of neurological disorders like Parkinson's and Alzheimer's disease. Interestingly, this wonderful glycine is also reducing the inflammation of lungs in COVID-19 patients. So what's the role of glycine in COVID-19 patients? We are all aware when the coronavirus attacks a person, it infects the airways and causes lung inflammation. The virus also multiplies inside the cells, and in severe cases there will be a hyperactivation of white blood cells. This will in turn releases the greater amounts of pro-inflammatory substance called cytokines, directing the immune defenses to overshoot. So the release of cytokines in highest quantity like a storm is called cytokine storm. Here the rapidly increased cytokines will also attract an excess number of immune cells such as neutrophils and lymphocytes, resulting in an infiltration of these cells into the lung tissues and thus causing the lung injury. Hence the cytokine storm will ultimately result in high fever, excessive leakiness of blood vessels, blood clotting inside the body, extremely low blood pressure, lack of oxygen, excess acidity of the blood and build up the fluids in lungs. And this overall condition is known as cytokine storm syndrome. As mentioned earlier, glycine is an inhibitory neurotransmitter, and apart from neurotransmission, it also involves in regulating our immune system to reduce the inflammation so as to promote healing. So the new studies found that coronavirus is changing its form or mutating itself in spike protein at the position of glycine. This will drag all the body's glycine for the virus survival and leading to glycine depletion in our body. Now the insufficient levels of glycine in our body leads to inflammation, olfactory cell death and lack of communication between the brain and sensory organs. This will result in symptoms like high fever, anosmia or lack of smell, ageusia or lack of taste, etc. And this is the reason for many patients being hospitalized. The viral protein also rapidly eats away the glycine from vital organs like lungs, heart and kidney. Doctors have also mentioned that 20% of COVID-19 recovery patients are suffering from dementia and schizophrenia due to the deficiency of glycine, which is involved in the neurotransmission. Hence, the doctors have concluded that glycine deficiency is one of the major reasons for cytokine storm, which is leading to vital organ damage and death. So more consumption of glycine is required to protect our body against coronavirus internally and to reduce the post complications of COVID-19 recovery. Poultry skin, pork skin or gelatin powder, sesame seeds, mustard seeds, seafoods, spinach and meat etc. are found to be the richest source of glycine. Thank you very much.